I've always treated headaches, but I normally use the typical physical therapy approach. It's like an upper cervical problem, stuff like that. Now I'm realizing more and more that there's a thoracic spine involvement to it. Dizziness, kind of the same thing. I use the typical like vertigo, BPPB model, stuff like that, but that with chronic dizziness, I realize there's more of a thoracic spine component to it. Basically, with any of these symptoms, whenever a patient initially was reporting that these symptoms were changing, it was because I was treating them for a different problem. So it was kind of like an accident at first. Yeah. You know, they'd come in for a shoulder issue, and we're treating the thoracic spine, and they're saying stuff like, "Hey, like I didn't tell you this, but I've had this like brain fog issue for a long time, and I've seen a bunch of people, neurologists, you know, specialists, stuff like that. And since we've been working together, it's gotten a lot better." And the first, you know, how many times that you hear this, you kind of brush it off. You're like, hey, maybe it's coincidental. Maybe, you know, your pain was causing you some anxiety, stress, or difficulty sleeping, stuff like that, right? But then when you keep hearing it over and over again, and then you start looking into, all right, well, what's the underlying like anatomy, physiology, like that could explain this? You start thinking, oh shit, like there's a real reason why this could be the underlying cause. And if so, it's very likely that a lot of these symptoms and these conditions are being misdiagnosed.